Hello, everyone, and welcome. I'd like to begin by welcoming everyone to our Church and Society webinar, Confined and Vulnerable, Detained and Incarcerated during COVID-19. This is the second of a 5-part webinar series on COVID-19 and pre-existing disparities exposed. In the midst of this public health crisis, we wanted to highlight the intersections and specific vulnerabilities of people who are incarcerated and confined in detention centers. We also wanted to address the way the justice system and current relief packages could better provide resources and support for these communities. As we begin, I want to take note of the agenda and introduce myself. I'm Reverend Katie Monforte. I'm the Education Program Coordinator at Church and Society, and I will serve as one of the webinar hosts for today. For our panel discussion, we will be in conversation with Gabriela Vieira from Detention Watch Network and Kara Gotch of the Sentencing Project. Following the panel, we will have a ministry highlight with Reverend Adrian Zachary and a call to action from Reverend Jeannie Moore, our Director of Civil and Human Rights. Please be sure to generate questions throughout today's webinar through the question and answer feature. We will have a question and answer segment led by Amy Hong, our Senior Executive Director of Education and Engagement. We will close with announcements. I begin with a big word of thanks to our expert panelists for sharing their passion and expertise with us. Kara Gotch is the Director of Strategic Initiatives. She oversees the Sentencing Project's federal advocacy work and develops special projects and partnerships to advance the mission of reducing mass incarceration. Kara returned to the Sentencing Project in 2016 after serving as the Director of Advocacy from 2005 to 2012, where she helped lead a multi-year effort to reform the notorious 100-to-1 crack cocaine sentencing disparity that resulted in the passage of the Fair Sentencing Act. Her sentencing reform work was honored by the Congresswoman Maxine Waters. Gabriela Vieira is an advocacy associate with the Detention Watch Network. She supports their mission of abolition through advocacy and coalition building, while serving as a policy resource for the network. Prior to her work at Detention Watch Network, Gabby was a fellow with the Friends National Committee on Legislation, working on their immigration, refugee, and policy portfolio. She studied Caribbean history with a concentration of race, gender, and sexuality at Yale University. We will now move forward into a conversation with our speakers. Awesome, we have Kara and Gabby. If you would both put on your videos and unmute, that would be helpful. Our first question is to help us move into the conversation of the connections between prisons and detention centers. Both speakers will have an opportunity to address this question, but Kara, could you respond to it first? The
Sure.
question is, thanks. What is the connection between prisons and detention centers? And can you explain the term crim immigration?
Sure. So when we talk about prisons or jails, those are a kind of detention facility that exists in the criminal justice system. People who have been convicted of a crime, either under federal law or state law, could be incarcerated if they're convicted and incarcerated in a prison or a jail. When we talk about detention for example, ICE detention, that usually applies to people who are housed there are those who've not been convicted of crimes, but of a civil, they're held on for civil infractions, for violations of immigration law. So they're two different systems, but the detention and all that goes with it is very much the same. The experience is very much the same. Although in some respects, immigration detention, I'm sure Gabby could talk much better about this, could be even worse because you don't have a lot of the same rights that you do as someone who's incarcerated. And, there's more programming and that kind of thing. But generally speaking, it's an unpleasant experience. Now, crimmigration, that terminology is used in the context of the intersection of those two spaces. So individuals who are non-citizens who are caught up in the criminal justice system for whatever reason face additional consequences because of that conviction, simply because they are not a non-citizen. And this applies to people who are undocumented and people who are in the country legally. You can lose your permanent residency if you have a felony conviction, and be deported after serving your sentence. So the crimmigration is sort of the intersection of those two areas of law and how the criminal justice system impacts people who are non-citizens.
Thanks, Kara.
Yeah, so thanks, Kara. I think the kind of context that I'll add is just, first of all, we always like to name the fact that, jails, prisons, detention centers, cages in all their forms are all part of the greater carceral state. That's rooted in racism, right? All part of a government that responds to its people who are struggling only with impunity and wanting to punish them instead of investing in them and helping them thrive. And so, of course, like Kara mentioned, the experience becomes very similar. And in addition to, again, most heavily impacting Black and Brown and poor folks, if you really look at the underlying structures, you can see how deeply intertwined the criminal, legal, and immigration systems are. Just due to the way that immigration law is written and just as importantly, how it's interpreted, immigrants do fill our jails and prisons, both under immigration custody, since ICE contracts with a ton of public, county, and city jails for immigration detention in addition to their own detention centers, but also under criminal custody. And folks are constantly fed from one system to the other. And like Kara again mentioned, there are endless barriers for immigrants with prior convictions to be able to access any kind of status or immigration relief. And many times convictions will actually strip people of status that they already have. So yeah, this crimmigration reality, I guess, is part of, is not only recognizing how the government criminalizes the act of migration and immigrants themselves, embedding them into our criminal legal system, but also how the racist and classist criminal legal system feeds into the immigration detention and deportation machine. And that's something that, we view as a critical piece of the broader movement for decarceration.
Thank you both for outlining those systematic and structural connections. The next question is again directed to the two of you, and I'll let you go first, Gabby. So as of May 13th, 2 people in detention centers have died from COVID-19, while 373 inmates have died from COVID-19. Can you describe the situation and conditions of people who are currently incarcerated and detained? And are the pleas of those who are detained and incarcerated being heard, along with those who are their family members and the broader advocacy community?
Sure, and I'll let Kara address the more criminal justice side of things. But in terms of ICE detention, as we're all probably aware of at this point, people locked up in ICE detention are extremely vulnerable to the spread of infectious disease due to many things, including the deprivation of their liberty. They're already deteriorating health while in detention. They're physical proximity to others and just inability to take basic health and safety precautions, and also just the already horrendous record of substandard medical care in ICE custody. So unsurprisingly, we're receiving widespread reports of just horrible conditions and across the network of facilities, and things like insufficient soap and hand sanitizer and like other health and cleaning supplies, not having enough of it. Stories about guards who refuse to wear PPE, and of ICE just neglecting to provide the people in its custody with information about the virus and how to keep themselves safe. As of yesterday, there are over 1,300 confirmed cases of COVID-19 among people in ICE detention. And we know that that's actually likely a huge underestimation, given the fact that like only about 10% of the almost 26,000 people still in detention have been tested, but over 50% of everyone who's been tested has tested positive. So that, you know, the rate of infection is extremely high. Like you mentioned, there have been, we say 3 deaths, like you said, that we know of, since we also try to acknowledge those who pass immediately after leaving detention due to medical or other issues gotten from being inside, as was sadly the case with Oscar Lopez Acosta a couple weeks ago. But what we also want to make sure is clear is that coronavirus just illuminates how deeply flawed our immigration detention system is always. Like you said, like it's always been plagued by egregiously poor conditions, zero accountability, and really a culture of violence where abuse and death aren't the exception or special to this moment. You know, they're endemic to the system. But in terms of folks in detention being heard, I will say that one of the things we're also seeing is a massive response from people on the inside who are obviously scared for their lives right now and organizing strikes and protests against their detention. I think in March, we recorded at least, since March, we've recorded at least 20 hunger strikes with somewhere like 2,000 people across the country participating. And for reference, we recorded 13 hunger strikes in all of 2019. So now we're at 20 just since March. And, you know, so what this is, it's like it's a nationwide trend of immigrants in ICE jails refusing meals, knowingly weakening their immune systems during a pandemic, because, I mean, they know that no matter what, ICE is not going to be prioritizing their safety. Most of the time, actually, ICE responds to this stuff by retaliating against folks, you know, by putting them in solitary confinement for extended periods of time, barring them from being able to communicate with counsel or loved ones, or actually inflicting physical harm. We've seen multiple cases of guards pepper spraying people who are protesting their detention since the pandemic started. But again, that, you know, seeing this, I mean, they're being heard. You know, one of the few small victories we can actually claim is that after 2 rounds of hunger strikes throughout April at the Mesa Verde facility, they actually released all the women that were being detained there this month. And we also saw the first stimulus package to even mention ICE detention get passed through the House this month. And granted, the provisions are extremely limited and we would love to see them expanded. But, you know, again, we're making noise. They're making noise because ICE hasn't done anywhere close to what it needs to do to keep people in its custody safe. And we know that it won't.
So for prisons and jails, you know, just to provide some basics, there's about 2.2 million people incarcerated in prisons and jails in the United States. Most of those facilities, or many of those facilities, are significantly overcrowded. Also, just the design of many of those facilities just prevents social distancing or physical distancing, which is one of the primary recommendations for the Centers for Disease Control, which is keeping 6 feet between yourself and others. That's simply not possible to do in prisons and jails. We also know that, you know, similar to what we're hearing in ICE detention, you know, there isn't ready access to PPE, to supplies such as soap, and even water, certainly not hand sanitizer, or even just general cleaning supplies. There's lots of concern. Interestingly, we're also hearing lots of concern from correctional officers, because correctional officers are also being infected as well and dying. It's important to keep in mind how the COVID-19 has been introduced. So unfortunately, testing has been sporadic, and so we don't have great numbers on how many people who are in prisons and jails have been infected. But the Marshall Project, which some of you may know, has been keeping a tally. And as of last week, about 29,000 people in prisons, and that's prisons only, that doesn't include jail. So that's about 1.5 million people in prisons. About 30,000 have tested positive. Over 400 have died, and that's just in prisons again. That's not counting people in jails. We have reason to believe that's an undercount, that there's many more people who are infected and the disease is spreading, and it will continue to spread unless we take really immediate action to significantly reduce the levels of incarceration so that we can end overcrowding, we can make space so that people can social distance, that people can get the supplies that they need, and that vulnerable people can come home. For the coalition, my organization, the coalition I work in, called the Justice Roundtable, we are really prioritizing getting people out of facilities, particularly people who are over 50 or over, or have pre-existing medical conditions. Because as the CDC has told us, those are the people most vulnerable to death. What we're seeing across the country is, certain hotspots are seeing higher infection rates and mortality than others. Part of that is just because some places are doing a better job reporting, but places like Louisiana and Ohio and New York and elsewhere, where there's high infection rates in the community, there are also, not surprisingly, high infection rates in prisons and jails. And so it is very regional, but it is really imperative that Congress take action at the federal level to help people in federal prisons, and that they also incentivize state leaders like governors and local leaders like mayors and sheriffs who run county lockups, that they emphasize decarceration, because decarceration, what we know from public health doctors, is that is really critical to ending the spread and limiting the spread, because it will allow for social distancing, which is really a critical component to ending the spread. So there has been some progress. We have seen significant declines in jail populations. Jail, keep in mind, those folks who are in jails are being held pre-trial. They have not been convicted of any crime. Many are there simply because they're too poor to pay bail. Or if they're not being held pre-trial, they're being held on a misdemeanor, which by definition is a low-level offense. It's people serving a sentence less than a year. Those numbers have gone down. We have not seen significant declines, however, in the prison population, either at the state level or the federal level, despite lots of lip service otherwise. It's very troubling, particularly in prisons, because we know there's a significant aged population of people who are in prison. Many have served long periods of time and are not a threat to public safety because of what we know about the aging out of crime. People who are older are much more mature, and their risk of recidivism is very low. And so continuing to hold those folks who we know are vulnerable because of their age, and we know are very low public safety risks because of their age, really need to be moved out and also be provided some reentry services. Now, in the last, when Congress was it the end of March? Time moves so quickly. We passed the CARES Act. Now, there was some money in the CARES Act, $100 million for the Federal Bureau of Prisons to provide funding for sanitation and PPE and testing and medical treatment. That's good. I mean, because when I started my advocacy earlier in the month, I couldn't get anything. Every congressional office I talked to said, no, we're not doing anything for people who are incarcerated. So we did get some money for for people in federal custody. And then there was $850 million provided to states to provide similar funding for medical care, supplies, in state and local facilities. Also in the CARES Act, which passed Congress and was signed by the president, included gave authority to the Attorney General to lift current caps on the use of home confinement, which is different from a release, right? It's just transferring someone from a penitentiary to incarceration essentially in their home. That authority was very broad, but unfortunately the way that the Attorney General has interpreted that, it's extremely limited. And they have only about 2% of the overall federal population has actually been transferred, despite the authority Congress has given the Department of Justice to do otherwise. We're pushing now for much broader and more comprehensive reform. We were very pleased, my coalition was very pleased with the HEROES Act that passed the House. It had a lot of good provisions for people in prisons and jails. But the Senate is a big question mark, and we're hoping to get some traction over there to support similar measures.
Thanks, Kara. Our next question actually has to do with the difference between prisons and jails. When we look at the Prison Policy Institute, they had shared that there was a drastic cut to the population in jails, while state prisons seem to be releasing almost no one. Why do you think that this difference exists, and what protocols are in place to help support and protect citizens who are returning during this pandemic?
So I think the main reason for the difference is because of the population, right? I mean, most people who are in jails are there for pre-trial. They've not been convicted of any offenses. And again, they're there, many of them are there because they are too poor to pay bail, right? They otherwise could be released, return home, live with their families, continue to work. But because of our system of bail in this country, that's not possible. It's good that jurisdictions around the country have recognized that during a pandemic, maintaining those policies is a bad idea. And so I think that can explain why there's been a decline in the jail population. Also, as I said, for those who have been convicted and continue to be in jails, they've been convicted of misdemeanor offenses, right? They're not felony convictions. Again, relatively low-level offenses and easily penalties that they can serve in the community, not requiring incarceration. We sort of over-rely on incarceration as the sole source of a sentence, right? I mean, one can be held accountable in many different ways, but in this country, we are very reliant on incarceration really as the only punishment. That's the only way people are held accountable, or in many ways, even though there are other ways to hold people accountable. So, as I said, we're really disappointed that there have not been more releases of people who are in prison, particularly because of what we know about the population of incarcerated people in prisons. They're older, they generally have very poor health. Many of them have pre-existing conditions. When they come in, they have, they're disproportionately more likely to suffer from mental illness, to suffer from substance use disorders, and therefore have compromised health already. And so introducing a pandemic into the scenario is very scary because it is generally not a healthy population. So they need special medical care and medical attention.
Thanks, Kara. So back in April, a federal judge in California ordered ICE to consider releasing detainees at high risk of COVID-19. Has ICE kept a record of those who might be at risk, and how many individuals have been released?
Yeah, that's a great question. Right. So after ICE claimed to have done and completed such a review and only reportedly released just shy of 700 people for COVID-related reasons, that court order came out. They ordered ICE to essentially redo the assessment and kind of expanded the class of people who fell under that category of being high risk. But according to the agency's acting director, they've completed this new review as well, supposedly. But advocate groups across the country can tell you that there are still so many people with conditions that make them vulnerable to the virus in custody, people whose requests for release ICE continues to actively deny. So it's unclear to us what those numbers really are. ICE, as usual, is acting with very little transparency. Most they've done so far is they've added a section to their webpage for COVID reporting for releases that were made due to that court order. It was actually just updated today. It was only 392 so far since the court order. More people have been released. Obviously, nowhere near what that number needs to be. Because again, let's be clear, I think I want to emphasize, like Kara was saying, ICE has all the authority to and absolutely should release everyone in its custody. Releasing folks who have particular vulnerability to the virus should definitely be a priority, but no one should have to languish in confinement, especially now. And no matter what ICE tries to say, they have all the discretion in the world to just let folks go with or without a formal process. So I guess just to like give a very brief answer in terms of how many individuals have been released for COVID related reasons, the like number that we're getting from ICE is like similarly about like 2 or 3%, but like the real answer will just continue to be not enough until we're able to get every single person out.
Thanks, Gabby. The next question is again for both of our panelists. For the purposes of understanding our social ills prior to COVID-19, we know that prisons and detention centers are disproportionately filled with Black and brown bodies. Can you explain to us how both detention centers and the prison industrial complex profit from detaining and incarcerating people of color?
Who do you want to go first?
Go ahead, Kara.
Okay.
Thanks.
So yeah, racial disparity and bias as proliferates the criminal legal system, from who gets stopped, who gets arrested, who is charged, convicted, and sentenced. And, you know, 2/3 of the people who are incarcerated in prisons and jails in this country are people of color. And so whenever talking about the need for change in this space, it's always important to put race front and center, because it very much is influential in who is behind bars, right? And so it's a really important point to be making. And you know, I was quickly reading the questions, some of the questions here in the Q&A, and someone talked about Paul Manafort and Michael Cohen and how they've gotten out, despite the fact, and for people who don't know, they're former Trump campaign allies who got mixed up with the Russia probe, and both wealthy white men and who have just begun their federal sentences but have been transferred to home confinement. I know many other people in federal prisons who are also very much eligible for home confinement transfers and have not been transferred. And I keep getting this question, well, why did they get out? Because they haven't met the qualifications that have been outlined by the Attorney General. They have very clear criteria that they've shared on who is eligible. You have to have a certain risk score, you have to have served a certain proportion of your time, you have to be of certain age, and they don't meet those qualifications, but still they got out. And it's because there is injustice in the system. And it's really heartbreaking as an advocate to be trying to explain to colleagues and friends I have who are incarcerated that the system is just unfair. And I don't justify, I'm not holding that up as justification for what's happening. But this is the reality we're living in. The system needs to be fair. And it's really frustrating to advance reform when we know it's different results for different people. And, you know, when you're talking about the profit motive, you know, there's different kinds of profit motives. And I think there's often in the criminal justice space a reflex to push on private prisons, for example. Well, private prisons in the criminal justice system, they're only 8% of who incarcerates people. Most people incarcerated are in publicly run institutions run by government employees. We are paying for their incarceration. And the reason why we have mass incarceration, from my perspective, is not because of private prison companies, it's because of a public that has allowed mass incarceration to proliferate for 40 years. And so we need to be looking at ourselves and taking responsibility for that. And not, I think the impulse often is, oh, well, it's these companies that are trying to make money. It's like, we've allowed this to happen. And private industry has capitalized on the public's willingness to tolerate mass incarceration and the mass and overwhelming incarceration of Black and brown people. And that is us. That is our public moral responsibility to fix. And obviously there is a need to address, profit motives within that, but it's not just about that. It's not just about that.
So to give I completely agree with what Kara said, and to give kind of like the other side of the dial, because so much of ICE detention is actually privately run.
Yeah, it's absolutely different for ICE.
Yeah. but also ICE, there's a lot of different entities that make money off of ICE jails. I will say that financial incentives are endemic to the system. It's how ICE is able to operate a network of over 200 facilities across the country. Like I was saying, they'll often contract directly or indirectly with private prison companies that'll operate entire facilities and profit in billions of dollars. I think it's actually over 80% of people detained by ICE are detained in a facility run by a private corporation. And just to name some names, the most prolific companies, at least in immigration detention, are the Geo Group, CoreCivic. Those two are the major ones. There are a few others springing up a lot as well, like Management and Training Corporation, Immigration Centers of America, and LaSalle. But ICE will also contract with local governments that will detain immigrants in exchange for huge sums of money. And really, they see these centers as sources for job creation, right? And so they'll often, so I think I want to say somewhere like 2/3 of ICE's contracts are actually with local governments. And the reason that the majority is still privately run is that local governments can also then subcontract with private prison corporations to actually run the facilities. And that process, again, makes for like really blurred accountability, because, once you try to find legal liability for things that happen at facilities, and it's like, who owns the contract, who's operating, who's actually accountable here, and everyone's pointing fingers. But yeah, so you'll often hear stories of struggling cities and counties, especially in rural areas, actually actively seeking ICE out. A lot of the times after a local jail has been shut down, to be able to open it back up and start filling beds again, and have more jobs in the region. And of course, there are also tons of other private companies that provide all the services needed on the inside of the facilities. So like transportation or food provisions, things like that. And in every case, of course, there are clear incentives for these entities to detain more and more people while reducing the per person costs, just meaning that the more people they jail and the more corners they cut spending on their health and safety, the more money there is to be made. So again, in practice, these financial incentives really cause private companies, as well as our own government at all levels, to just view immigrants as potential income instead of actual human beings, which just continues to pave the way for more abuse.
In order to move us forward and to find places of hope, can you both name how we can help bring attention to these unsafe conditions and the injustice that we're seeing, this racism that we're trying to dismantle within the justice system? How would you recommend us to move forward and raise our voices in advocacy? Kara, would you mind going first?
Sure, no problem.
Thank you.
So I work with a coalition that includes folks at GBCS and other faith-based organizations in trying to emphasize and prioritize during this period of time, and always decarceration, reducing levels of incarceration. Now more than ever, it is so critical to be calling your members of Congress, senators, your members of the House of Representatives, but also state officials, the governor's office, your state lawmakers. All of these entities have a responsibility and have influence on our criminal justice policies. And you do, I think people don't like when I say that, I give this answer of contact your leaders, your elected representatives, but you do have power and it does influence their decision making. It's so important. Until we have a groundswell of public interest and public compassion for these issues, we're not going to get this, we're not going to see the change we need to see, right? Until we can flood offices with calls and demands for change, then it's not going to be achieved. So, you know, I can certainly point you to various calls to action, take actions. I'm sure GBCS has their own. My organization is hosting a briefing, congressional briefing tomorrow for Hill staff about the need to decarcerate. It would be great if, you know, Monday morning they came back with a full mailbox, voice mailbox saying, I want, you know, the Senate to pass the HEROES Act provisions around decarceration of prisons and jails. That would be a really impactful and very welcome for me and many of my colleagues.
Yeah, I'll definitely second that. If you could also throw ICE detention in there, that would be great for us. Yeah, again, really second what Kara said, like elected officials at all levels of government are extremely important right now. And the other thing I'll just add is there's obviously a ton of advocate research and reports and government resources online out there, but I would say just like the major thing that folks can do is support the local groups in your communities that are doing this work, that are doing the work to support people who are detained, to get them out, and then continuing to support folks if they do get out, because Lord knows the government isn't doing that. And so, you know, find out who they are, what they're doing, and plug in, uplift, help out in whatever way you can, because this work is exhausting, but our communities are doing it. And so like all the backup folks can get is essential. And I'll say for us, I'm sorry, I don't know, I didn't give a huge background on what Detention Watch Network is, but Detention Watch Network is a membership-based coalition, and we're made up of over 100 member organizations across the country, the local grassroots groups, state groups, national groups, just working on all kinds of different things, but towards the same vision of abolition. And so, you know, one of the things we did was launch the Free Them All campaign with a set of our grassroots member organizations back in March. And we're actually having I'll say for us, we're actually having coordinated days of action today and tomorrow to keep amplifying the demands from people on the inside. There's a bunch of different ways that people can plug in, solidarity actions that folks can take, both actually like in person, of course, with safety precautions, and virtually. All the information's on our website as well. But I'd say the best resources for people are probably coming from some of their own neighbors.
Thank you both for pushing the urgency of acting now and using the many layers that we have, the networks and the connections that are already built for us. Thanks for sharing the work that you both are doing through the lens of community building and advocacy. We are so grateful to know that you both are out there creating good change for this world. We're gonna transition to our next section, but I know that as the questions and answers portion comes forward, you both will be able to offer so much. So the next segment will be introducing Reverend Jeannie Marie Moore and Reverend Adrian Zachary and we'll be doing a ministry highlight and give opportunities for action. Thank you.
Thanks, Katie, and thank you, Kara and Gabriella, for the fantastic information. The question, I've been keeping an eye on the Q&A, which is just coming in with so much that you have elicited. So thank you. As we have discussed, the ongoing COVID-19 pandemic has exposed how very broken and unjust our systems of incarceration and detention are. Jails, prisons, and migrant detention centers harm and threaten rather than heal and support people, families, communities, and society as a whole. As United Methodists who believe that systems should be healing and restorative, reflecting God's desires for our world, we can work for change. And to talk to us about some of the actions that we can take in our communities and congregations, we have with us here today, Reverend Adrian Zachary. Pastor Zachary is the lead pastor of Crossroads United Methodist Church in Compton, California, with the California Pacific Annual Conference. So Reverend Adrian, welcome and thank you for joining us.
Good afternoon. Thank you, Reverend Jeannie Ree, as well as Katie, for this opportunity to share.
Pastor Adrian, can you share with us about the ministry at Crossroads UMC and how COVID-19 has impacted this ministry?
Yes, thank you. In March, the state of California and the Los Angeles County made a mandate that the prisons in Los Angeles County were to release those who were incarcerated because of the population and the exposure from the COVID-19. And so in response to hearing that 3,500 men and women would be released and returned to our communities, Crossroads Church developed the Crossroads Reentry Resource Center. And a part of the program that we were able to develop was to have hygiene kits that we recognized when many who were unsheltered before they were incarcerated and now returning home would need basic hygiene and grooming items. And so we were able to pull together some partners. About 6 years ago, Crossroads Church was had an expungement clinic. And so with that expungement clinic, we were able to partner with the Legal Aid Foundation and some nonprofit organizations around the work with those who had been impacted by the justice system. And so those partners came alongside, as well as our denominational agencies, the United Methodist Women, as well as the California Pacific Annual Conference, Church and Society, all in our denomination, were able to galvanize and mobilize around making these hygiene kits. And so in our clarion call, we were able to have 3,500 kits donated to Crossroads Church. And what that has enabled us to do is to be able to share those kits with detentions, with transitional homes. We've been working with chaplains in the Southern California area, as well as the Department of Probation and Parole, to get kits, hygiene kits, in the hands of those who are released.
Thank you, Pastor Adrian, for that incredible ministry and for explaining a bit about the history and how your previous partnership and work with allies within faith communities and broader allies in the community, as well as government, has helped position Crossroads to take action to serve re-entering citizens, returning citizens rather, at this moment in time. A second question for you: how can the faith community participate in supporting returning citizens generally, and especially right now during COVID-19?
I think that the very first way that the houses of faith would be able to help those who are returning is to be able to see the humanity and the sanctity in all life. That many times our houses of faith have criminalized and have seen the conviction of individuals in a way that paints them in a very negative and a light that would see them as less than human. So the first thing that I think that I would offer is the humanization and hospitality that houses of faith can offer to those who are returning. Working with the city of Compton, we have been able to be integral in hospitality and hosting and sheltering in a way to help those who are returning by being a safe place and a place that does not judge or criticize, but gives hope and healing. And to change the conversation, to change the language, the narrative, to not use words like convict and felon in our interaction, in our interfacing with those who are returning, and to be able to be a place by which, even if there has been a negative past, that through the opportunity to have served your time, there's no other entity by which you've served your time, and then when you come home, that you are still criminalized and to be seen as negative when you have paid your debt to society. So to be hospitable, to be able to be seen and welcomed, is a place that the houses of faith can begin.
Thank you, Pastor Adrienne. And I'll just add, from knowing your congregation and your tremendous work, that in addition to serving returning citizens, I know that you work with families as well, and you recognize in your work that the carceral system impacts broadly. Like you said, when an individual has returned, they're still serving time, and their families often are as well. And so I really admire how your ministry, both before COVID and then during this pandemic, has continued to serve the entire community that is impacted by incarceration. So thank you. And I'll just also note that it's evident that you're a United Methodist pastor. Your language echoes our main resolution on criminal justice, which is humanizing criminal justice, and using that humanization as a tool, primary tool of reform. So thank you again so much for sharing with us.
Yes.
We are going to transition now to something that Kara mentioned earlier, which is how GBCS is empowering United Methodists and anyone who would like to join with us in taking action. And so in addition to taking some of the steps that Pastor Zachary just shared with us within our communities and congregations, we can also work for change through advocacy, specifically by calling our elected officials and demanding that they support the health and wellness of adults and youth who are in and emerging from prisons, jails, and migrant detention centers. So as you can see on our website, www.umcjustice.org, we have up right now several resources for you to use to call your members of Congress. The Capitol Switchboard phone number is listed, and I encourage you to make it a contact in your cell phone for easy access. And there's also a sample script for you to use in advocating reform in the broken systems of incarceration and migrant detention. So call your elected officials and demand that they support decarceration in jails, prisons, and migrant detention facilities, that they protect the health and safety of those who will remain incarcerated and detained, and that they lift the bans that prevent those being released from accessing social services such as SNAP, TANF, and housing support. And finally, that they ensure that all have access to economic relief programs, including migrants and formerly incarcerated individuals. These are several of the asks that we are encouraging you to make on your elected officials. And we also have a resource that you can use to support you in calling your decision makers, your elected officials. This is a one-pager that walks you through the process. If you have done it before, it might be a helpful refresher. If you have not done it before, definitely take a look. Again, please join us in calling on Congress to implement changes in policy and institutional practice, and join with your congregations and local communities to take action. Thank you.
We hope that many United Methodists will take this call and this urgency to take action. Thanks for outlining and giving us a script, Jeannie, so this is an easier process for us. The next segment will be led by Amy Hong, and it will be our question and answer segment.
Thank you all for submitting your questions. I believe that some of them have already been answered just in the way that Kara and Gabby have been answering. But here are a few that we hope to address now. And the first question goes to Gabby. Are there numbers of deaths and or infection rates being counted of the makeshift camps at the border? The camps mainly created because of the Remain in Mexico policy.
Right, so that actually falls under the authority of Customs and Border Protection, or CBP, in terms of the Remain in Mexico policy and kind of enforcing it. And CBP refuses to do any reporting as of now. One of the things that we're trying to get in the next stimulus package or any COVID relief legislation is really to be able to get that kind of CBP to do that kind of reporting. But again, naming that if I think what you're referring to are the camps that are on the Mexico side, in which case it would still be difficult for us to keep track of. But I will say that, again, one of the things to name is that we're seeing one of the points that we're having to negotiate is the fact that the numbers in ICE detention, despite the small percentage of people that have been released because of COVID related reasons, have been decreasing. And it's actually because of those policies that are closing down our border, that are shutting people out, restricting asylum. And so we are actually not apprehending as many people because they're being turned away immediately. And really their rights to seek asylum being violated. And so unfortunately we don't have those numbers. We would love to get them, but as of now, we're just fighting to even see what that looks like.
Great, thank you so much. Kara, so the next question goes to you. And I know that you've been keeping an eye on those questions, so this one will not be a surprise. So are there any efforts or movements around building solidarity between prison staff and incarcerated persons? Interestingly, after the Attica massacre, there was some belated recognition that both groups were taken advantage of by the state.
Yeah, there has been. For example, in the District of Columbia, which has a local jail, there's been litigation filed on behalf of those who are incarcerated at the jail that has been joined by the Correctional Officers Union. Correctional officers are confirming with those who are incarcerated at the jail that conditions are not, are bad. They're not sanitary, and they're exacerbating the risks faced by both those who are incarcerated and the people who have to work in the jail. So, I mean, that's an example. I know that actually in some other states as well, there's been some litigation filed by the American Civil Liberties Union, including in Louisiana regarding the federal prison there. Oakdale, I don't know if people are familiar with that, FCI Oakdale, where there's been a number of deaths at that facility and high rates of infection. Particularly when this pandemic began, correctional officers were, going with people who became ill to the hospital and sitting with them as guards in the hospital rooms with no protective gear whatsoever, and not surprisingly contracting COVID-19 as well. And so they have filed litigation for hazard pay and filed OSHA violations against the government because they did not educate the correctional officers about the consequences. I've heard reports out of that facility where correctional officers were meeting with prisoners saying, we're all in the same boat. They don't care about either of us. We're all going to get sick. Our bosses aren't protecting us either. There has been a number of cases or instances of solidarity, because I think the correctional officers have recognized that they are not being protected the way they should be you know, lots of reports of correctional officers who were knowingly exposed to people who had COVID-19 being required to report to work and continue with their duties. You know, I mean, outrageous, really outrageous situations. I just read a story, I think yesterday actually, about a woman whose husband works at a Tennessee prison and has joined forces with the wives of a number of the men incarcerated at that facility to advocate for reforms and improvements in the facility and more transparency about the conditions there. She's been getting heat, according to this article, from the administration of the prison for speaking out. But she feels it's really important because the conditions are bad for everyone, right? Everybody's lives are in jeopardy. And so it is to everyone's, it's beneficial for everyone to unite and work to improve the situation.
Thank you. It seems like Reverend Adrian might have a comment. You might need to unmute.
I just wanted to share that my cousin was incarcerated in the Oakdale prison in Louisiana and was able to be a benefactor of the CARES Act and was released. So there has, from the outcry and from that legislation that was passed, he was released about 3 weeks ago, and he was tested and then self-quarantined after his release. And so there have been some great benefits to those causes that you all have championed. Thank you.
That's a great story to hear. Thank you for sharing that.
Yeah. So the next question that I have is for Gabby. What are some actionable items the general public can do to try to force more transparency from ICE? It often seems like detention centers are like this black box that no one really knows what's going on inside. So what are some things that we can do to have an idea of what's happening inside?
I mean, I would completely agree with that. They are, and they are intentionally a black box. ICE intentionally tries to hide what happens in facilities, how they continue to expand, their process of bringing people in. And really, I mean, a big piece of that is calling on elected officials to use their oversight authority to like make sure that they're keeping ICE accountable. I know like a lot of our groups are trying to get, our member organizations are trying to get members of Congress and other elected officials really, and even officials from the like public health departments to go and visit these facilities and see for themselves, document for themselves what is going on. There have been a ton, so the Department of Homeland Security, which houses ICE, has an Office of Investigation, and there have been tons and tons of investigations and reports done detailing exactly what we've been saying, detailing the horrible conditions. But again, ICE continues to operate, and though it can say that it fixed its problems, you know, the office will make recommendations, let's say it fixed its problems. So it's like having that constant oversight is essential. But overall, again, for us, that's for in the meantime, until we can actually work towards getting everyone released, because in reality, you know, making the conditions in a facility better, first of all, ICE won't, that's according to their record, ICE is not going to do that. Anytime they get more funds, all they use it for is continuing to detain more and more people instead of making their facilities more livable. And so we know that that's not ICE's mission. ICE doesn't care about this health and safety of the people in their custody. And then on top of it, it's just like, again, making a nicer cage isn't going to help people. And so really it's like making sure that oversight is there, but with the messaging of like trying to move folks to be calling for release, because that's, you know, asking elected officials to actually fight for massive decreases in the detention population.
Thanks, Gabby. I have one more question for Kara. if an incarcerated individual gets COVID-19, could they take legal action against the owner of the holding facility or file a civil suit?
So, I mean, there is protections to some extent for people who are incarcerated. The Eighth Amendment protects them from cruel and unusual punishment. So certainly, one could file litigation claiming that their Eighth Amendment rights had been violated if what is called deliberate indifference is present. That correctional officers, that the administration of a facility or correctional officers knowingly expose this individual, or not knowingly, but created conditions that made it possible for them to get COVID-19. It is a very high threshold that someone would have to meet to be successful. There's something called the Prison Litigation Reform Act that generally makes it very hard, that passed in the 90s, makes it very hard for people who are incarcerated to file litigation because they have to exhaust what's called administrative remedies. They can't, they're limited on how many cases they can bring. Lawyers that might represent them have their fees capped. There's lots of requirements and obstacles to filing litigation. That's not saying it's impossible, and there has been litigation filed across the country. Whether it will be successful is, who knows? We'll see.
Thank you. Due to time, we are going to end the question and answer session. But some of these questions hopefully were answered during the webinar, and for those that weren't, we hope to answer them in the follow-up email. Thanks.
Thank you.
Thank you, Amy, and thank you to our panelists and guests for just continuing this educational conversation, for showing us through your specific lenses and perspectives what is happening and how we can really act together to come about and create change. We've come to the close of our webinar, and so there are just a few reminders and announcements. Please remember, in order to register for a webinar, you must register for each individual webinar. Our next webinar is From Ground to Table, Food Insecurity During COVID-19. We are grateful for all the participants who just engaged in this conversation, to our panelists, Gabby and Kara, for educating us, for Reverend Adrian for sharing about your ministry, giving a window into these realities and giving us the urgency to act. We encourage people to share this webinar with others. So you can rewatch our webinar at our YouTube page at UMC Justice, and there will be a follow-up email with some of the resources spoken about here. So thank you all for your engagement and participation. We hope to see you next week. Thank you.